Relieving your low back pain is really about knowing what you need, what activity you need in the moment that you feel the pain. So I was just talking to my group of women in my yoga class, and I was asking, well, what do you use every day to make yourself feel a little bit better? Or what movement do you use every day to strengthen those weakest parts of you so that you can grow that support for your core and your spine? So it's really important to know what you need in the moment. So today I'm going to show you 4 activities that, depending on when you feel the pain, so I'll give you 4 different scenarios, and so you can try these strategies for when you might need them. I'm Stephanie Carter Kelly, a physical therapist that uses yoga in just about everything that I do. So when I listen to somebody tell me about the pattern of their pain, I can then help them match the activity that they need to relieve pain in that moment. So number one of the first times during the day that people say they have low back pain is when they wake up in the morning or when they roll out of bed. So there are a few reasons for that, but I'm just going to take the most superficial reason, and that is because they've probably been still all night long. And so that stillness, non-movement during the night relates to stiffness. So instead of just rolling out of bed and going, oh, I feel so stiff, there's a few things that you can do in bed in the morning to start that spine moving so that you'll feel better rolling out of bed. So here's what I like to do. So you wake up, whether you're on your side or on your back, you're going to come onto your back, knees bent, feet on the floor, and just do a few cat-cows. What I call cat-cows on your back. So we just take the same motion of cat-cow that is traditionally done in yoga on all fours, and you do it on your back. So you arch your back and you flatten your back. And you can start this movement really small, little tiny oscillations of movement. The pelvis rocks back and forth. If you've ever been to physical therapy, you might have heard a posterior pelvic tilt, which flattens the back, and an anterior pelvic tilt, which arches the back. And so you just want to oscillate back and forth. This does not take very long at all to do. You're just giving that spine a chance to move a little bit before you even go to move and stand up or sit on the side of the bed, however you get out of bed. So just start with these cat-cows first thing in the morning, if that is where you feel the most pain. Number 2, you have been sitting for a long time. So whether that is sitting at your desk, concentrating on an activity, or sitting in a car, when you get out of the car or when you go to stand up, many people will say, oh, I feel that in my back. So in the same way, if you've been sitting for a long period of time, you can kind of do the same thing. To start is pay attention to, well, what position were you sitting in? Car seats put us almost always into this rounded position. So can you come out of, so what has happened is that you've sustained this rounded position in sitting for a long period of time, very still, not moving. So we need to ease that spine back into a more arched position. So you can focus on that arched position before you go to stand up. Because as soon as you go from sitting to standing, now you've taken your back and you've put it into an arched position. Standing is more about having an arch in your back. So if when you go to standing and you're like, oh, I feel that because I'm sort of stuck in this flexed position, just lengthen the spine, and you can put your hands on your hips and do a little bit of that backward bending. You can let the hips move forward and just do, 5, 3, 5, 10 of these. A lot of times in physical therapy we say do 10 repetitions. So whatever the amount of repetitions that you do that helps get that spine now in extension so that you can move with the freedom that you need. So that was number 2. Number 3 is that you've been standing too long. So if you've been standing for a long period of time, or say shopping, that slow walking of shopping and, browsing, maybe that is what increases the pain in your low back. So as I said, standing is more of an arch in the low back or extension in the low back. So now we want to take the spine in the opposite direction and maybe flex it. So can you find a place to sit and just rock into flexion or rounding of the low back? If you can't find a place to sit, a lot of times I just drop into a deep squat, which is not easy, and I've had to train myself to get into this position over time, but I'll just drop into a deep squat and let that sort of round out my low back. If I am near a curb, sometimes I'm near a curb or something, I'll just sit down on a low curb and feel that sort of stretch out my low back. You can also, if you've been standing and you feel that discomfort, again, we're trying to round out the spine, you could elevate your leg. So I'm giving you more than 4 activities. But I'm giving you a few activities for each scenario of when you might feel the pain. The 4th scenario, where people might feel the pain, and I'm just coming here so I can talk to you, is when you feel stress. So recognizing that out of bed in the morning, sitting for too long, standing for too long, and it's not too long, it's just you've been sustained in those positions. You might also have some stress in those situations. As soon as you wake up in the morning, you might just automatically go into your brain thinking of all the things that you need to do in that day. And so that might bring a little bit of that tension into your low back. And so you can relieve that pain by taking a few deep breaths, or maybe starting your day with some meditation. If you've been sitting for a long period of time at work, or you're not relaxed in that sitting position, and you might compare sitting in different situations. How is sitting at work compared to sitting at home at night, maybe watching a television show or reading a book? Is there a difference in how you feel in those 2 different situations? If so, maybe it's the stress associated with sitting during the day. And again, taking just 3 nice deep breaths to sort of shift the nervous system and create that decreased stress. Standing is the same thing. So if what you're doing while you're standing is stressful, then is it the flexion that your spine needs, or is it just those 3 or 4, 5 deep breaths? Some strategy that makes you aware of that you're feeling that stress, that little bit of anxiety that will trigger your pain. So I've given you 4 situations and a lot of little activities of ways that you can relieve your pain throughout the day. It all starts with a practice of awareness, paying very careful attention to when you feel your pain and what's going on all around you. Do you need to move your body, or do you need to address the stress in the nervous system? I hope this helps. Let me know. I'm really curious if out of bed, sitting for a long period of time, or standing for a long period of time, if those aren't your triggers, then what is? What are your triggers of your pain that you think from a positional perspective that increase your pain? And I'll try to address those in the comments, giving you some ideas of even these strategies that we've used, maybe helping you target those a little bit better. Have a great rest of your day. Namaste.